Before we can explain the techniques we use to treat the underlying causes of your symptoms, we must first discuss trauma and how it affects your health. A trauma is an electrical force that disrupts your body and its electrical field and can be caused by physical, chemical, electrical, or emotional event and/or foreign organisms. With the technology we have today, we know that these external events have their own electrical signature. When these electrical events are great enough, they overwhelm the electrical field of our body, and the brain perceives a trauma event. The brain then alters the physiology and structure of the body based on the nature of the trauma, resulting in a stress reaction. This all happens on an electrical level. Because your body functions on electrical potential, when you have an electrical event that disrupts your electrical field, your brain will perceive that as trauma, and your brain will change your whole physical being. Each organ has an emotion associated with it. Here's an example. Disruption to your liver is associated with anger. Your brain records and adapts these traumas, and the brain associates each trauma with an emotion. This has a subconscious effect on our health that stays with us for years after the traumatic event. So, when we remember a traumatic event, the brain will duplicate the physiology that occurred at the time of the event. The electrical current of the body and mind is altered by the memory of a trauma. As you can see, your symptoms are just the tip of the iceberg. And we found with our patients that 9 times out of 10, their symptoms are the result of trauma. And next, we're going to explain the science behind how traumatic events not just alter your mind and body, but also your DNA.